Heavily pregnant nurse has died from coronavirus after medics tried to save her baby. Mary Agyewa Agyapong, 28, underwent an emergency caesarean to deliver and save her baby daughter at Luton and Dunstable Hospital. Sadly, she did not survive and died on Sunday. It has not been confirmed whether the baby has tested positive for the virus. Colleagues said the mum was fabulous nurse and great example of what we stand for. Chief Executive of the NHS Trust, David Carter, said the nurse was wonderful young woman who made huge contribution. According to Channel 4, an internal email to staff told how the decision was made to perform an emergency cesarean after her condition deteriorated. Doctors had previously thought her condition had been improving, but she worsened on Sunday. The baby is described as beacon of light at this very dark time. In statement, Mr. Carter said, "It is with great sadness that can confirm the death of one of our nurses, Mary Agyewa Agyapong, who passed away on Sunday, 12 April. Mary worked here for 5 years and was highly valued and loved member of our team, fantastic nurse and great example of what we stand for in this trust. She tested positive for COVID-19 after being tested on 5 April and was admitted to the hospital on 7 April. Our thoughts and deepest condolences are with Mary's family and friends at this sad time. We ask that the family's privacy is respected at this time. At least 30 NHS workers have died." While working on the front line of the coronavirus fight, medics have been calling for more personal protection equipment with reports of nurses sharing masks and gowns. Health Secretary Matt Hancock has promised to investigate every death of an NHS worker. Number 10 insisted 22 million items were delivered to 268 organizations across the NHS on Easter Monday, including more than 2.5 million aprons. The Prime Minister's spokesman said, "We have always acknowledged there have been some issues in terms of distribution, but where that has occurred we have worked very hard to resolve them." Meanwhile, one researcher claimed the PPE crisis as the 21st century's Dunkirk. University of Oxford professor Tricia Greenhalgh is leading reviews of research on PPE. Referring to the evacuation of Allied soldiers in the Second World War, she said, "As COVID-19 deaths escalate, the main story about PPE has become the lack of it. Primary and secondary care are running low on various items. Some National Health Service staff claim they've been told to buy their own. The media is buzzing with stories of visors being 3D printed in garden sheds, masks stitched together on kitchen sewing machines, and small construction companies donating boxes of masks intended for building sites. Keeping the NHS in PPE has become the 21st century's Dunkirk."